Hi, I'm Ginille, a cosmetic nurse practitioner of 13 years. I have 3 medical spas, 2 in Los Angeles, 1 in Las Vegas. My team and I specialize in natural looking aesthetic results where you're gonna look like you're gonna look fresh, never overdone. Everything we do in our office is gonna be safe for all skin types, all skin tones. I can talk to you about any of the aesthetic questions that you have on your mind, beauty questions, hair, skin, health. We can go through all that, wellness, Botox, filler. I can talk to you about treatments I have done. I can talk to you about patients I have treated and their before and afters. So we can go through anything on your mind. If you have questions, please feel free to drop them in there or invite yourself into the box. We can do our consult here one-on-one. Hi, Mackenzie. I need to check in with you to see how clinic was for the rest of the team today. Mackenzie's my best friend. All right, guys, if you have any questions, let me know. This is me here. I like to show this because I think a lot of people are like, oh my gosh, you don't need Botox and filler. Stop talking about it. Or, oh my gosh, Botox and filler, you're going to look crazy. And I'm like, no, this is me prior to having any treatments done. 28 years old. I'm now 38 years old. I've got 3 babies. I have breastfed these children for 2 to 2.5 years, each of them. I'm still breastfeeding now. This is me 10 years older than where I am here. This is prior to doing treatments. And this is just one of the results. I can show you through patient before and after. Sometimes I set them up here on the screen. But I can also just show you, I'm sitting in clinic before I go home, and I can talk to you about some of the patients that we have seen in our office and their results and how they look fresh and how they look like themselves and never overdone. And I really like to showcase natural results. And I shout out my patients because if it weren't for them allowing us to use their patient before and after photos, consenting to use these photos to share what natural looking results can look like, you guys wouldn't know these people have done any treatments because you would just see them walking down the street thinking they look fresh. I'm like, that's the point. We never want it to look overdone. So these are just some of the pictures we have hanging up in a couple of the rooms that we have, and I can go through these patients and treatments they've done. But we have hundreds, if not thousands, of patient before and after photos where patients have consented to share their pictures so you can see what natural looking results look like. And here's some more patients on this side. In our office, we treat all skin types, all skin tones. We see everybody. And again, when you see their afters, they're going to look like themselves. They're going to look refreshed, never overdone. Like you wouldn't know that these people have done treatments. That's always our goal when we're doing these treatments. And so I just want to kind of show you, just look at her after photo. Could you guess what treatments this girl has done if you just saw this after photo of her? Probably not. You probably would think she's never done treatments. Like she just looks great and she's beautiful. Here she is before, still very beautiful, but when she came in, she felt like her chin set back. So she felt like she had more of a round face, more fullness in her mid face, and she felt like her chin set back. So we were trying to balance her upper and lower face features. And so what we did here was doing some filler into the chin to elongate her jawline. And so you can see some of the dimpling here in her chin prior, and then here after, it's just smoothed out. That's the goal. Like it's gonna look like you, it's gonna look fresh. You would not think she's done anything. And this is immediately after. So immediately after, you can bruise, you can swell, that's normal. It'll look a little exaggerated. You know, I say give it 2 to 3 weeks for the swelling and bruising to settle. Some people were like, I didn't bruise, I didn't swell at all because they prepped beforehand. So I try to get on here. I try to educate about how to prep for these treatments, what to expect with them, how you can set yourself up for the best possible outcomes. And then we do consults, virtual consults, in-person consults before we're doing treatment, just so that you know, again, what to expect, how to prep for it. But yeah, like this is her. And I tell patients 1.5 to 2 years that your filler lasts, but most patients are getting longer out of it where they're not having to come and redo the same thing every year, or they're not having to do as much. If they are maintaining, they're typically doing like half or less than that when we're doing maintenance. Here is another, this guy is wonderful and I've treated him for years. And if you just looked at him, what would you think about him? What treatments would you think he's done? probably would just be like, I don't know, he just has great skin. And that's the whole point. We want it to look like you just have great skin. We just want it to look like you're refreshed. Here he is before. And so treatments we have done, and we have done more treatments since this. And he shares before and afters. He makes videos with us just showcasing, again, natural results. But we've done Botox to soften out some of the lines in the forehead. We've done under eye filler. His biggest concern was he felt like he looked tired. He was trying to camouflage the little fat pad underneath his eyes. So we did filler underneath the eyes to lift the skin, camouflage that eye bag there. And yeah, like I said, if you just saw him walking around, you would never think he's done Botox and filler. That's the whole point. We have also done, not in this photo, but I have other photos of him where we've done filler into his chin and jawline, gave him a little bit more angularity at the chin and jawline, a teeny bit more width. And then we have done PRF injections and the scalp facial, so hair treatments for hair growth. So he was bleaching his hair. He was noticing that his hair was getting thinner at the crown, and I have really good before and afters of the hair, and we've made videos. But like you can see, his hair had totally like regrown in these areas where he was having patchiness. So yeah, this is what it can look like when we're doing cosmetic treatments. Okay, I want to make sure I'm not missing questions. If you have questions, please feel free to like jump in. You can say them and I will keep scrolling and make sure I hit them all. Or if you want, you can invite yourself into the little box there and we can go through, we can do a consult here online, or we can set up one-on-one time virtually or in person. If you have questions, you can also call or text me. You can text the number at the top of the page. I said hey to Mackenzie earlier. She is one of our team members I have worked with for years. She is on every question. Like I see all the messages that go through, but Mackenzie also really helps to answer everything. And she has worked side by side with me for years, seeing these patients and helping us to take care of them and get beautiful outcomes. So for her, again, so beautiful. We've done several treatments over the years. This is like fresh off the needle, right when we had finished a little bit of lip filler and some filler into her chin to elongate. We have also done filler underneath her eyes and into her cheeks, and we have done Botox over the years. She's beautiful. Again, you wouldn't think she's done anything. That's the whole point. This patient here, this is her after. You wouldn't think anything has been done. That's the whole point. Again, she just looks fresh. We did some filler underneath her eyes and into her cheeks. She had lost some weight and she was noticing like a little bit more hollowness underneath the eyes. So we did some filler here to lift. We've also done Botox treatment. We've done some filler into her cheeks. I have her full face photos that she allows us to use as well, and just beautiful. But here I was really trying to showcase her before and afters of the eyes. What products, Coco said, hi, what products do you recommend for hyperpigmentation? So for hyperpigmentation, which is darkening of the skin, usually from sun, but it could be from other things. First and foremost, make sure you're using sunscreen and that you are reapplying your sunscreen. That is the most important. If you're getting sun on your face, that's going to cause dark spots or hyperpigmentation. From there, using a retinoid at home. And so your retinoid is going to help turn skin cells over faster, helps with fine lines, pores, dark spots, skin texture, acne scars, collagen stimulation. It's one of the most effective things you can do. I try to keep it simple for patients at home. I'm like, use your sunscreen. I love our Jossie sunscreen. We have this one and we also have a tinted one. I have the tinted one on right now. Love it. I use this one. This is non-tinted as well. I really was looking for a non-tinted mineral-based sunscreen that I wanted to create for black and brown skin that doesn't show up pasty. So I love this one. We also have a tinted one. And then your retinoid. So retinoid, you remember I was saying turns skin cells over faster, helps with fine lines, pores, dark spots. This is Resurface RX. This is our Jossie brand. You can use that one. If you're like, I've been using a retinol for a long time and I'm told my skin totally tolerates it, I'm not irritated by it, then you can go ahead and use a prescription Retin-A or tretinoin. So in the office, we dispense Retin-A. We have the 0.05 and then we have the 0.1. So patients love those. And yeah, so I'm a nurse practitioner. I can help with prescribing those. We also have a dermatology nurse practitioner on our team, a Black dermatology nurse practitioner. Her name is Niani. She is excellent. I highly encourage you guys to check her out. It's really hard to find like women of color as aesthetic, dermatology nurse practitioners. So come see her. We treat a lot of acne, we treat a lot of dark spots, we do hair removal in our office, all the things, redness, rosacea, the DPNs, the little flat moles that we can get on our neck and our face and our chest. So we do that. But yeah, okay. Can you do upper platysmal jawline without the lower bands to achieve this snatched effect? You can do that like to help kind of with the jowls. You just want to be careful that after, if you're like flexing, that these bands don't show. Just let me know why you don't want to do the lower ones. But yes, you can. It's just the other part of the muscle might be like flexing a lot and could show the bands. Okay, hey, God bless, child, God bless you. I hope you're doing great. I am located in Los Angeles. So we've got 2 clinics here, Ginille Beauty Aesthetics, but we're switching the name right now to Jossie Skin and Wellness. So if you look me up, if you find my name, you'll find the office. Los Angeles, we're in Mar Vista and in Torrance. And then we have 1 clinic in Las Vegas on the Summerlin side. So I see patients at all of them. We have great team members at all of them. These are girls that I trust with my life, with my face. Yeah. Coco also said, let me see, what treatments do you recommend for brightening or skin for brightening? For brightening, 2 things. So definitely at home, our vitamin C, this one is great, green tea serum. I use this in the morning time. Antioxidants, that really helps with like protection against just environmental, you don't want that. So toxins, you want to use your vitamin C. And then I love our bio repill chemical peel. Let me see if I can pull it in one of the in one of our drawers here. So the bio repill chemical peel, it comes like this. It's separated blue and yellow, and then we mix it. It turns into a pretty green. This is safe for all skin types, all skin tones. We put this on face, neck, chest. I have been doing that once or twice a month for the past quarter. And I mean, brightening, absolutely love it. I do it on my family members. My husband, who says he can never tell any change with anything, he keeps asking me. He's like, can we do that again? Can we do that again? Because I'm like, oh, why? He's like, I think I can see a difference. I'm like, you think? Yeah, you can. So that's definitely great for brightening. Again, safe for all skin types and tones. It's not a crazy peel where you're like peeling your skin off. If anything, you might get a teeny bit flaky, a little bit dry, but nothing crazy. You can pair that with the hydrofacial if you're like, I don't want to peel at all. Or if you're like, I want to peel, I want to see visible peeling, and some of our patients do. That's when we start combining it with our Aerolase laser and our skin pin microneedling. You can do them on the same day. For patients that are really working on skin texture, more hyperpigmentation, if they've done treatments, like their skin can tolerate it a little bit more, that's when we're going to be going a little bit more aggressive. For those that don't want any downtime or anybody that gets really dry with the active ingredients, that's when we like to pair it on the same day with the hydrofacial. Okay. Let me see if I've missed messages. I'm so sorry if I have. I'm going to go back there. Is there a specific kind of filler that does not make you look puffy, like a specific brand? Hey, D, so let me know what areas of the face you're thinking about treating. All filler can bind water, but there's certain ones, depending on like the parts of the face that we are treating, that I feel like have less tendency to bind water. So I like Radiesse on somebody that has like thick, full cheeks, more fat in their face, more fullness. It mimics bone. It gives the most structure. I don't feel like it binds a bunch of water, and I don't feel like it gives a puffy look. And again, I can show you more patient before and after photos, and you can tell me if you think they look puffy, but I think these people just look hot. I love Radiesse. I had it in my face. Also the natural filler, the PRF EZ Gel, made entirely from your own blood, your growth factors, your stem cell. That does not look puffy. So that is a really great option. I can show you guys that machine as well. What are some factors that reduce the efficacy of Botox? Is it mostly exercise? Hey, Jay. Yes, if you metabolize things faster, if you exercise a lot, when I have marathon runners, CrossFitters, they kind of wear through their stuff a little bit quicker. Anybody that gets hot, like a lot of saunas, those things are kind of like sweating through it a little bit quicker. I've heard from colleagues that treat patients, you know, in Arizona or like hotter states where like it's always hot here. They kind of wear through it, especially a little faster in the summer months. So I would say, yeah, saunas, exercise, heat, those are the main things. Also, if you want to increase the longevity of your Botox, you can do more units. So the more units you do, the longer your Botox lasts, and it is going to be the more restricted, like the more you've weakened that muscle. So the more like frozen-ish you are. Okay, let me see if there are. Hi, Amy. I hope you're doing so well. You're so beautiful. Okay, I just want to make sure I'm not missing. I'm trying to go through any questions, and then if not, I will show you guys some more patient before and afters, and we can talk through them. We got the hyperpigmentation. We talked about that. We talked about brightening. So you want your sunscreen, your retinoid, your vitamin C, and then do the bio repill. Okay, and I'm going to go back down, make sure I didn't miss anything. And then we'll go, hi, Cammy. Somebody named Cammy. I have a baby named Cam, and I call him Cammy. Okay, cheeks. D, I like Radius, but again, it depends on the person. If you don't have much fat in your face and not much fullness, Radius might look a little too angular, and so that's when I'd probably go with Restylane Lift or Voluma. Okay, let me keep talking to you guys about some patient before and afters. And if you have questions, hit me up with them or jump in this box. I'm going to just talk for a little bit, and then I got to go home and do my next real job, which is see babies. Okay. This patient came to me. She had lost 100 pounds. And she was like, I'm really happy with my body. I got to my goals there. However, I feel like my face just looks sunken. Like I don't look as lifted, and she just didn't feel confident in that. So we did filler underneath her eyes. I should probably get a little pointer. We did filler underneath her eyes. We did filler into her lips, into her cheeks, into her chin, and a little into her smile lines as well. She's a little swollen immediately after, so it's slightly exaggerated. It won't stay so angular. This is Radius. Dee was asking me in there like different products. So this is someone with fuller, thicker skin. We use Radius to create more of that contour. And we also, like I said, brought forward the chin. Her chin from a different angle, you can see it's like a little bit more square. So she wanted that a little bit more V-shaped. We softened the corners of the mouth. We don't want to just do lips. She wanted to full her lips, even though I thought her lips looked great. But she wanted to full her lips, but we don't want to just do lips and then have these like saggy corners of the mouth. So we did a little bit there to frame the lips. Okay. Above. Again, if you see this girl walking down the street, you're just going to be like, oh my gosh, she's so pretty, right? She is so pretty. Even before anything, she's so pretty. Like, she's just beautiful. She just felt like she looked tired. I believe she was finishing law school or something. And so she wanted to camouflage the under eye fat pads. We did some filler underneath her eyes and into her cheeks on both sides to lift the skin up. We did some filler into her lips. She wanted to make the Cupid's bow a little bit more angled and more defined and wanted more fullness. And then she felt like her chin looked more square here, and we wanted to round that out. She wanted to minimize the appearance of the cleft, and so we did some filler here. So again, beautiful. You can see she's a little poked up because this is immediately after. She has sent us her selfies that I should show you guys. So she just looks dang beautiful. And like, you would never know. She looks just super natural. That's always a point. And she looks like herself. That's always the biggest thing. Like, I want it to look like you. We're not trying to morph everybody's face into being the same face. That's not it. So that's very important to us. Okay, let me see if there are questions. That's what I really want, but I heard it can migrate. So, okay. So, yeah, the thing is, it can migrate. When people are talking about migrate, I don't really think fillers like slipping and sliding around your face. Migration, I really think people are meaning overfilled. When you see these stories online and people are saying, oh my gosh, my lip filler, it's always their freaking lip filler or their under eyes. My lip filler migrated, my lip filler migrated. I'm like, tell me more, tell me more. Oh, I saw a video of you squishing your filler right after you got it. Don't do that. Like, I tell patients, your filler takes up to 6 to 8 weeks to fully settle. Yet I see people on TikTok online, not my patients, they know better, but I see people on here and they're like, oh, I just got filler, I'm trying to massage the bumps. I tell our patients, don't touch it. It is moldable. It's a gel. If you are touching your filler, you're going to move it. Leave it alone. So yeah, people smashing it around, like, you're going to move it. It's a gel. It's going to move. No, my patients are not here. Read my reviews, guys. Google my name. Like, look at the reviews. Look at the patients making their own videos about their experiences. They're not saying migration. Like, that's just not it. The other thing is, when people are talking about migration, they're overfilling. So I'm like, they're coming to me to dissolve something from another clinic or whatever. And I'm like, okay, tell me about it. I did my lips, and then they let me, and then I did more in 2 weeks. And then I did more in 2 weeks. I'm like, dude, the swelling is like just kind of chilling around that time. Yet you keep adding more. There's not space for more filler in your lips. So they're trying to shove it in there, and there's not space. So yeah, it's above the border. It's just overfilled. Same for the under eyes. People will try to be like, I don't want any line here at all. I don't want any line. And I'm like, you know, if you're not the right candidate, if they overfill it, it's going to look bad. And then they say it's migration. And then I think the common person is like, oh my gosh, if you get filler, it's going to migrate and it's going to slip around your face. It's not. Go to somebody who's been doing it a long time. Go to somebody that can show you hundreds, thousands of patient before and after photos, all types of faces. If you look at the thing, like you see, we see everybody here. We treat men, women, we treat all skin types, all skin tones, old, young, I don't care. We treat everybody. I do every part of the face, and so does my team. And we really focus on you looking balanced, you looking natural, like yourself, never overdone. And the things I hear from patients, I'm like, what did your family say? What did your friends say? And they're like, nobody knew, but they'll say stuff to me like, I got carded when I went out. Or they'll say, you look so rested, you look fresh. Like, did you change something? Did you change your hair? Did you change your makeup? Like, what are you using? Like, they don't know. They can't clock it. That's the whole point. That is the whole point. So no, I don't think if you're going to get filler, it's going to be migrating if you're doing it the right way. See somebody that really knows what they're doing. Don't rush it. I will not retreat a same area for 6 to 8 weeks at least. So I say, let it settle. If you're trying to come in and add more in 3 weeks, no, just, it's not. Like, they know, don't even ask me that, because I'm gonna be like, no, dude. Like, do you want to look crazy or do you want to come to me for a reason? So that's the whole point. Okay. I'm getting out of breath, but let me make sure I'm not missing any. Come to Massachusetts, Valentina. God bless you. Holy, I am in 3 clinics. So we got 2 in Los Angeles, Mar Vista in Torrance, and then 1 in Las Vegas. So I'm switching all of the names of our clinics. It's been under my name, Ginille Beauty Aesthetics, since I've been on my own and since 2021. But I've been a cosmetic nurse practitioner since 2013. All I do, guys, is inject and do skin and hair. Like, I only do cosmetics. That's it. I went to Stanford, I went to Duke, but now I have 3 medical spas, and I've got teams of providers, and they all have their own patients. Everybody's seeing everybody. So now the clinic is going to be under Jossie. So that's our skin line. And so all the clinics are switching to that name, JASI. Our website, I think we're going to launch it out the beginning of next week. We've got a new medical EMR, electronic medical record. So we're like in the transition of everything right now. But yes, please come see us. The number at the top of our page is where you can call us, text us, and help get set up. Felicia, do we have care credit in Las Vegas? Soon, God willing, soon, because they needed it to be under our new website name. So right now, I didn't bring the Ginille Beauty brand to Vegas because we're going to start everything. Everything is switching to Jossie. And right now, our website, they're like, your website is only selling skincare. But soon, like next week, we're going to be having Jossie Skin and Wellness, where we're going to have our skincare. We're going to have all of our medical aesthetics, all of our wellness. We do weight loss. We do wellness in our office. So soon, then we can get the care credit going there. Care credit, you guys, is financing. And so patients that'll be like, hey, do you do payment plans? You can pre-qualify through Sherry under our name. In LA, it's Ginille Beauty Aesthetics. Remember, it's going to switch to Jossie next week. And you can look up, you can like see what you qualify for. So let's say you're like, okay, I'm going to be doing multiple areas of my face. Let's say it comes out to $5,000. They'll say you can break this up into this many payment plans, and you do it through Cherry, which is really nice. Donna said, can we move it while we sleep? So if you get filler, I tell patients, sleep on your back, sleep a little elevated like that first couple of weeks. Try to be more careful. It's the most malleable, like right when you finish it. You got to think it's a gel. I probably have some I can like show you guys, but it's a gel, and you don't want to be mashing it down. And so I say, sleep on your back. Don't sleep on your face. Don't do gua sha. Don't massage it. Don't let people press on your face. Just hands off. But yeah, I would say don't mess with it. Try to sleep on your back. People say, that's kind of hard. I'm like, I know, but I just want you to have a great outcome. Can I book with you? Holy, yes. I would love to see you. If you want to, like I said, patients, if you want to jump, or people, if you want to jump on here, we can do a talk. Like people will come on here and we'll talk back and forth. Or if you want to book one-on-one, we can do a virtual call, or we can do in-person consults. Virtual calls are $150. That money gets applied to your treatment if you're doing treatment within 3 months from the time we do the virtual call. During this call, we're going through your questions, your goals, tips on what to expect, how to prep for treatments. We're talking through everything. So that when you come in, you're prepared. So we will talk through, I'm going to ask you a bunch of questions. Tell me what your concerns are. I'm going to ask you, are you changing weight? Are you planning to change weight? Are you getting ready for event? What's going on? Are you flying places? What do you do for work? Because it's going to be different if you're like, I'm a nun and I don't want anybody to know I've done anything, and I've treated nuns and I've treated pastors. And then the next person will be like, I'm a sex worker and I need these lips popping. So like that helps me determine you and your aesthetic goals, your lifestyle, all the things. If you're an actor, I'm linking, okay, what kind of roles do you play? Oh, okay, you play somebody that's distressed. Okay, I don't want to freeze your Botox, freeze you up. All of these things. You guys see I'm just talking. I'm talking a lot when I'm talking to you because I want to understand you. I want to understand your goals, your lifestyle, make sure it all fits with what we're trying to do. So that is what we do on our virtual calls. We'll go through your questions, goals. I talk to you about what treatments I recommend. I talk to you about how the face is aging, where we're losing fat, how fat pads are separating and sinking, where we're losing bone, how I inject so that it still looks like you and not crazy. And those are the biggest things, and how things can look balanced. I'm looking at like before and afters we have all in our office. They're like swiping through. Like she's somebody that came in, she had really full cheeks, and then her chin, can it go backwards, was like a little set back. And so we did some into her chin to bring it forward. Here's some jaw lines. We got photos, guys, I'm telling you, you can't even see because you got that light on it, but we got photos for everybody, all ages, all races, all the things, all day. This is what I do. And again, shout out to our patients for allowing us to share so that other people can see what natural looking results look like. Okay, let me make sure I didn't miss. I did miss questions. Sorry, guys. I got filler and Dysport yesterday the first time. It felt like it didn't take how long. So when you get your Dysport or your Botox, takes a few days to kick in, 2 weeks for the full effect. So you don't have the full effect just yet. After 2 weeks, check in with your provider. I need to see you ASAP. I've been with my injector for over 6 years and it's time to move on. Yeah, sometimes it's like time to move on, or sometimes people are like, can I just get a second opinion? And like, I might talk to you and say, hey, this looks great. Or, hey, have you considered, a lot of times when I'm looking at it, I'm like, hey, I can tell like your cheeks look great, but the other parts of the face are aging too. Maybe you have some temples, some volume loss here. Maybe your chin is back. I don't know, but I will say, guys, what I specialize and what my team specializes in faces and making sure it looks fresh. And we're not here to spot treat. We're not here to just chase the smile lines. We're not here to just do the lips. Like, we're really looking at the entire face when we're doing these treatments. Because we can't just, if I just treat the smile lines on the cheeks are saggy, it's going to look weird. It's going to look puffed out. If I just do your lips, but your chin is set back and this is saggy, it's going to look weird and it's going to look puffed out. So Gia is a big creator on here, and she's been coming to me for years. And I remember first time we did our call, she just did virtual call like I do for everybody. And I was like, hey, I see you online. I treat a lot of creators here on TikTok. But she came in and her first thing, and I have different views of her, but her first thing was like, again, you see Sujia online, y'all see her. I know you do. You don't think she's done anything, but she does talk about it. She's made videos and stuff about it. But she came in wanting to do lips. I did, okay, we did lips once or twice. She did her Botox and she kept trying to talk about lips. I was like, Sujia, girl, like this can't match. And your chin is sitting back. Like, I gotta do a little into these corners. I gotta like work on this jawline, or else it's just gonna look like you got your lips done. And like, we don't want to just look like we got our lips done. We don't want to look like we've done anything. So I'm like, I got it. Like, the whole face is aging. I can't just have popping lips and then saggy and then set back. So we talked about it. We did some here into the corners. You can see it's just less. And I have her other views somewhere in the clinic. I can show you. Like from the front, it's so cute. Or somewhere on my page too. And we've done filler into her cheeks and into the smile lines. And we've done some laser and chemical peel. And like, she just looks fresh. She just looks great. And she tells me, she's like, I feel like now the outside matches how I feel on the inside. And that's just nice to hear. People will tell me they just feel more confident showing up. A lot of these things that the patients are coming into me and talking to me about, I'm like, dude, you're so beautiful. Like, nobody's seeing that. Like, only you are talking about that. And they're like, I know. But for them, they really notice it and they feel concerned about it. Okay. Oh, somebody... I'm sorry, I'm just yapping. Let me go and talk to somebody. I thought you shouldn't get cheek fillers. No, that's a lie. It just depends on what's going on with your face. What's going on? Okay, let me sit down and stop talking so much and see. Somebody had come into the chat and I was trying to add them. So if you come back, I'll add you. Good morning from Huntsville, Alabama. What's the name of the filler that uses my own blood? That's PRF EZ Gel. Let me show you guys the machine. So this is a natural filler. We draw blood from your arm. We spin it in the spinner right here. This is a spinner. It'll spin. And then we take it out. When we take it out, it separates. It's going to be gold on top, red on the bottom. That gold part is your growth factors, your stem cells. From there, we put it into, this is a heater. Everything is off right now because clinic is done and I'm going to go home shortly. We put it into this, it's a heater, and it will thicken your growth factors and your stem cells. So from that, we make a gel. Out of that gel, I go and we can inject it anywhere in your face. I've done it my whole face, guys. Under eye, smile lines, cheeks, chin, temples, everywhere. With that, it's not going to give you the instant feel that you can get with like filler. If you're like, hey, I want my lips really defined, or I want my cheeks really defined, like, and you want instant, go filler. This is more of a collagen stimulator. So it's going to get better over time. Wherever we place it, think of it as a fertilizer. Collagen, we are losing collagen starting in our 20s, and collagen is what keeps things like looking lifted, useful, bouncy. We're losing it, and that's when everything starts kind of like sinking down and you're noticing the lines, da, da, da. So this is a natural way to restore collagen. We can do this on the same day. A lot of patients will do this, and they're doing skin treatments the same day. So they might be doing their laser, their chemical peel, this, and then maybe some Botox for like the forehead. But patients love this. I would say in your 20s and 30s, like early 30s, do 2 sessions, spread it a month apart, and you start getting mid 30s plus 3 sessions, spread a month apart. So 1 month, do it, skip, wait 4 weeks and do the next one for 3 times. Just because you want to retreat those same areas with those growth factors, with those stem cells. The healthier you are, the better the outcome. So that is something I give patients a heads up. I really like it. It's the only freaking filler that I've been doing for the past 3 years because I'm breastfeeding and I'm going to have to go home for that baby. I try to go home like a little bit after dinner because if he sees me, he's like, Mom's home, let's eat. And I'm like, I don't want to just feed this baby all day. Okay, does microneedling get rid of deep scars? If so, about how many sessions, or would you recommend aerolase? It might be a combination of aerolase and microneedling and the chemical peel. It depends on how deep they are. If they're really deep, I don't want to say it's going to be, oh my gosh, completely smooth, like you've never had scars at all. They will still probably be some of it, but they're going to be way less apparent. And I will say for patients that have struggled with scarring, they love the microneedling. So I would say your first time, if you've never done anything, do microneedling on its own. Once you've done it and you're like, hey, my skin can tolerate this, I'm cool. Then I would start adding in the laser and the chemical peel. They're going to work on different layers in the skin. And it's going to be a little bit more of that skin cell turnover. Okay, why do we do need a consultation for under eye treatments, or is it a set price? I like to do consultations with patients just so we can go through questions, goals, tips on what to expect, how to prep treatments. Some of these people come on here and they're like, I've been watching you for years. And like, I've been making videos, guys, since 2019, like 2020, like every day. So some people are like, I already know what you're going to say, and I've seen the videos, or we've talked live, or whatever. But I just want to make sure you're a good candidate when it comes to under eye treatment. So if you're thinking under eye filler, let me show you some fillers. If you want the immediate effect, that's where we're going to be using hyaluronic acid based filler. So this is a under eye filler. That's her after, that's her before. So camouflaging the appearance of the fat pad, under eye filler, camouflaging that appearance of the fat pad, under eye filler, instant result. Sorry, I need to get my picture out of the way. Let me put me down there. Instant result with your filler, hyaluronic acid based filler. Now, when we do under eye filler, you got to make sure you don't cry a lot. You don't have bad allergies. You don't swell. You don't wake up and you're always puffy. Oh, I eat salty foods and I get puffy. Anybody that retains water, not a candidate for under eye filler. Here's some more under eye fillers. You can see, oh my goodness, she's like, I feel like I look tired. I need to get these little bags away. And then here's her after. You wouldn't see this woman walking down the street. You wouldn't say, oh, she got filler up in her face. Nope. You wouldn't think that. That's the whole point. Under eye filler, again, hot girl. I mean, they're all so beautiful. Like, none of us need it. I know we don't need it, but like, they feel more confident. Like, she looks more balanced. We brought her chin forward. We did some underneath her eyes, into her lips. Like, if I only did her lips, you guys, lips would dominate, chin would sit back. That would not look right. Who else did under eye filler? Under eye filler. So different ages, I want to show you guys different faces, under eye filler, what it can look like. Now, if you're not a candidate for filler, if you cry, you say, I do wake up and I get puffy, or I got bad allergies, then we can do the natural filler. That's the one I was showing you guys earlier, where we draw your blood, we spin it, take out your growth factors, your stem cells. Even if you are a candidate for filler, some people are like, I just don't want it. or I really want the natural way, or I really want the collagen stimulation. So they're going that route. Some people, a lot of people are doing both. So some people will start with one or the other, and then we'll come in a few months later and like treat with the other one. So we want the collagen, and they kind of are getting that instant result from the filler. Okay, that's called PRF, Daniela. Yes, EZ Gel. So it's not just regular PRF. The regular PRF, it's the same process where we draw your blood and we spin it. But the regular PRF, you just take out the growth factors and your stem cells and you can inject it. But we do an extra step where we're heating it. You could read some really cool research on that. When we heat it, it makes a gel. It thickens these growth factors. You get longer exposure to the growth factors in your skin when you heat it because it's a gel, so it hangs on in there a little bit longer. And it gives you a little bit more of a lift than just doing the plain PRF on its own. You're not going to have issues with this. You're not going to have lumps and bumps. You're not going to have prolonged swelling. Like, we do so much of that in our office, all over the people's faces, and they love it. And a lot of people will do that, and they're like, I don't want to do filler. I only want to do this. We go through the conversation of, this is not instant. This is not going to give you the overnight result. This is an investment in your future self. The healthier you are, the better the outcome. We go through all the things so you can know what to expect. I can't get it as angular as I can get some of these fillers, on the person. As long as they understand it, yeah, and they love it. Some people are like, hey, I never want to have filler. I don't need to go back to filler. For my own self, I haven't had it in 3 years because I've been doing that because I'm breastfeeding. I don't feel like I need to go back to filler. Thank you, Daniela. I hope you're doing so great. Okay, let me scroll through. I'm so sorry. Do you check the EZ Gel potency of the growth factors? No. But I really do tell patients to go, the healthier you are, the better you're going to be. So when we spin it, we can see the clarity of the PRF. Somebody with a high fat diet, it's a little bit cloudy. Somebody with we had somebody smoking one time, it was gray instead of gold. And so that's how we can tell, but we're not doing exact measurements. I will tell patients, I'm the healthier and younger, the better your outcome. Mid 60s, I'm my husband is calling me, y'all. He is I know you're on that live. Okay, what's the thing? Sorry, I didn't know the name. She said NG. Okay, I'm so sorry. I'm going to try to go back to how would you address a bit of hollowness under the eye, visible tear troughs at 24, 25, either filler or the natural filler. Because you're young, I'm just scrolling, I can't remember the name, but because you're young, I would probably go the natural filler. I love filler, guys. I love it. This is what I do. And I got it all over my face and I do it all day on people. And this is what I've been doing since 2013. I went to Stanford. I went to Duke. I don't play around. I'm very meticulous about what I do. I love filler, but it requires way more finesse. You got to be the right patient. There's just more that comes along with filler. The natural one, I'm if you're okay with going a little slow, you can't go wrong. Now, if you're I'm seeing big depths, big hollows, I need this taken care of, I want to do it now, do the traditional filler. For people that have lost a lot of weight and they're seeing the sunkenness and they're feeling self-conscious, they're going to go traditional filler. I know I'm going to have to get off in a minute. Okay, smile line, Botox or fillers. These smile lines, if you got these, you can do filler or the natural filler or collagen stimulator like Sculptra or Dilute Radiesse. Okay, I'm trying to make sure. Thoughts on Pico laser? I like it. I was really thinking about getting it in our office, but I went with Aerolase because we can do more in one laser session. So Pico really focus on pigment. With the Aerolase, we can get pigment, we can get redness, we can get acne, we can get hair removal, we can do skin rejuvenation, we can do so many things. And so they're both cool. If you're really focused on just pigment, you can do that. Okay. Let me see. Smile. Sorry, AOL. She was smile line, Botox, or filler. Sorry. So don't put Botox here. You don't want to weaken the muscles from smiling. So filler to soften when you're doing smile lines. We're not trying to get them all the way gone. If you try to soften it all the way, what time is it? I want to make sure. Okay, if you try to get it all the way gone, it's going to look puffy. It's going to look overdone. Don't chase it to be gone. And then make sure we're making sure this is not, sunken. If this is sunken and you have puffy smile lines, it's going to look weird. Sometimes we'll put a little filler into the cheek to make the highlight up. And then don't forget about the corners of the mouth. You don't want to have no smile line here and then these sad lady lines right there. Okay, not lady, men too. Okay, is this PRP? Do we need a consultation for the under eyes? How to avoid balloon face? Sorry. Someone said, can I show us black patients? Oh my goodness, I've been showing these all day. Well, there's me also. I'm Filipino black. Okay, how to avoid, there's a bunch of patients. She's under eyes. She's face, her whole face. his face. I've done his chin, his eyes. Like there's a bunch there. I got everybody, guys. Like I really try to show all skin types, all skin tones, men and women, all the ages. And these are just some that I have in our other office, my bigger office. We have them all over the walls. We have them on the iPads. We want to show real results. We want, and go Google my name again. Go under Ginille Beauty. If you Google it, you can see so many patient before and afters and patient reviews and patients who make their own videos. So again, shout out to the patients for sharing. Okay, somebody was saying how to avoid balloon face. Don't overdo your filler. Go to somebody who knows what they're doing. Go to somebody that looks good and like their team looks good and their patients look good and their results are good, period. Like, I mean, that's like a big thing. You got to understand also there's limitations with these treatments. And so some people will be like, Ginille, I want this, like, just do this. And I'm like, everybody says it. I'm like, guys, I can't just do that. Like, that's surgery. Now, what I can do, and I'll show them pictures. Here's somebody who looks like you. Here's how we can create a highlight where it can look lifted, but it's not going to pull you up. If you want pulled up, you got to go talk to a surgeon and see. But even with surgery, there's going to be limitations, you know? I think when people try to keep thinking if they can fill and it's going to keep lifting, and I'm like, it's not. It's just going to look puffy. So we want to be strategic about where we're placing it. We want to think about where we are losing bone, where we are losing fat, how those fat pads are separating, how the face is aging, and not just the upper face is aging, guys. The lower face is also aging, and it looks so bad when people are walking around with just one part of their face is looking snatched and the rest is not. We know that person did something because it looks unfinished. It looks dumb. God forgive me. I don't mean to mean it like that. I'm not trying to be mean. I just don't like when people are like, y'all, like these injectors, like, stop. And they might not be meaning ill. They might just not know. But I'm really like, you got to think about the full face. Where look at this little thing. Like I'm trying to get all these tiny shadows on people. It's the details that make the biggest difference. And I'm like, only you and me are gonna know that this happened. But they can see it and they look fresh and they're like, nobody knows. I'm like, I know. Like if I go, I mean, I see it on myself when I'm talking. I see this like tiny shadow. Nobody's looking at that. But when that's straighter, I'm like, sheesh. People are going to be like, oh my gosh, Ginille, your jawline is so straight. Right now, they're not going to say that because I got this little shadow there. Anyway, these are the little details. The people that really understand it, makeup artists, any drawing artists, anybody that works on lights, on film and stuff, they really get what I do. And they have a good eye. Photographers, they have a good eye and they can really understand and see the difference. Painters, because it's a subtle thing that makes a big difference on how light hits off the face. And I don't think a lot of injectors think about that. I think they're kind of like, oh, I went to the training and they said to do a dot here and a dot here and a dot here and a line here. And I'm like, you can't, like, we can't textbook this stuff. Like, we really got to look at the face. We got to look at everybody's face and everybody's features are a little different and everybody's aesthetic goals and preferences are a little different. You know, I have some people that will tell me like, you know, I have a bump on my nose. I want you to soften it, but I don't want it all the way gone. You know, in my eyes, I'm like, oh, I can make that light completely straight, but like, I don't want it completely straight. So this is why we got to do a consult and talk about your goals and make sure what we're doing lines up to you and your aesthetic preferences and make sure you look fresh. Okay, my first time getting injections at 34. Should I get Botox or Dysport? I like Dysport. I mean, I love them both, but I mean, I if I had to pick one on my own self, I pick Dysport. I feel like it's a little stronger, lasts a little longer. That's my preference. I tell patients, try the different ones, see if you have one that you prefer. I had a patient today, I've treated her for years. She said, let's try the Dysport. And then she said, I didn't like Dysport as much. I like Botox. So you just have to see if you like it. What I recommend for a heavy lower face, let me see your face or show them. I just need to know a little bit more. Is it here? Is it the chin sits back? Is it the fullness underneath? I kind of got to know a little bit more. My injector will only do masseter Dysport twice a year to avoid jowls. How is this true? I mean, stop. I mean, whatever. Like, I know everybody's always like, you're going to get jowls. I'm like, dude, don't overdo it. I will treat patients more, especially if I'm doing with TMJ symptoms. Clenching, headaches, teeth grinding, jaw pain. You know, it depends on the dose, it depends on what's going on. If you feel like you're getting jowly, then pull back on the dose or stop. But if you're not and you're doing this for medical reasons, I'm like, don't crack your teeth. I've had a lot of people with broken teeth. You don't want that. I think if we're overdoing this, it can get slim, but it's really meh. Thoughts on peptides? We use Zepbound in our office for medically supervised weight loss. The other ones, I'm just slow to jump on things. It might end up being great. I just need to do more research. Yeah, and I got to do things that are FDA approved. Period. I can't be messing with people's faces and their bodies and their livelihoods and my Stanford and Duke degrees, and I can't be doing that. Or for my team, sunken under eye solution, maintenance, PRF EZ Gel, or filler. Filler, if you don't get puffy, if you don't cry a lot, you don't retain water. Okay, how do I recommend to reduce the heavy low face? Tell me again, like, what is it? Is it fullness here? If it's fullness here, it depends. Like you can definitely do Botox there to like tighten these, and that'll help it look a little bit tighter along the lower face. If it's like fat, I will tell patients liposuction is probably going to be the quickest way to get it out. Kybella is a non-surgical way to permanently dissolve fats and injections. It takes multiple vials, multiple sessions. So I'm like, if you're open to surgery, just do that. If their chin is set back and so it looks like they have a double chin because their jawline is short, when I do filler into the chin, it elongates the jawline, it camouflages the fullness underneath. So those are some things for the lower face without me seeing you and like knowing the whole story. Under the neck, filler or Botox for wrinkles. If it's some of those like little loose skin tightening, you can do it with Botox. If it's a texture thing, you can do dilute radius. Radius is a calcium-based filler. It mimics bone, but it has collagen stimulating properties. When we thin it out, we can put it in the neck. It'll help to give some tightening. I have some good pictures of that too. I just gotta find them. Okay, let me see. Located in Los Angeles and in Las Vegas. 2 clinics in LA. We got Mar Vista, Torrance, and then in Las Vegas, we're on the Summerlin side. Does age matter? Would you recommend it? Natural fillers for women in their late 40s. Depends on how much volume loss you have and what's going on. Like yesterday, I was talking to a lady that was 55. She did not even look in her 40s. And she was just like, hey, like I know naturally, like I got good genes and stuff going on. She didn't have a bunch of volume loss, but she's like, I'm trying to do something to maintain and like to prevent the aging. And so, yes, we talked about doing the natural. Now, if you're 40 and you have not a lot of fat in your face, you lost a bunch of weight recently, everybody's been losing weight the past few years, especially with the, Zepbound and the Ozempics, it might be filler. So it really depends on you and what's going on. If you're like not really seeing a ton of hollowness, volume loss, do the natural filler, is totally fine. If you're seeing stuff and you're like, I see this and I feel like I'm looking sunken and you want more of an immediate effect, do the filler. And it could be that you end up doing both over time. I'm scrolling back, guys, to go, hey, Danielle, I hope you're doing so great. Okay, I'm trying to see if I missed any. Okay, for smile line, what can you do for fine lines under the eyes? Under the eyes, use your retinoid. So those are the ones I was showing you guys earlier. I think one's up here. Resurface RX is the one that we will use, our retinoid, or your tretinoin. Our Retin-A, we prescribe it. Make sure you moisturize a thin layer of your retinoid because the skin is thinner. Moisturize before and after it. Do that a few times a week once your skin can tolerate it. If you can do it almost every day, go ahead. So that is good. And your sunscreen. And then in the office, your microneedling, you can get all the way up close, or your chemical peel. You can get all the way up close to the lid. With the Aerolase, I can't get this close to the eye. With the skin pen, you can. With microneedling or the chemical peel, you can. And that'll help for fine lines. If it's like when you smile, you can do like a teeny bit of Botox, just a little bit. You don't want to Botox too much or it'll pull down your eyelids. So like 1, maybe 2 units. Botox or filler, which is safer? I guess Botox, but they're both fine if you're doing it right. What do I like more, Rovolux or Jupiter Improved Gels? We don't have Rovolux FDA approved in the USA, so I don't know about that one. I got filler in my cheeks about 3 weeks ago, and I think I hate it. Nicole, give it, so 2 to 3 weeks, it's like swollen, and then it starts to settle, and then 6 to 8 weeks to fully settle. Let me see, Nicole, if I can see what you... So pretty. I can't see what it totally looks like. Just know in the beginning it looks a little exaggerated. Also I just have to hear more. Did they only inject here and it looks really full here and they didn't give you a lateral highlight? Is it like now that you're really full here and then your chin is set back and it looks unbalanced, or are you just swollen and you're just nervous because it's your first time? So still a little bit newish in it 3 weeks ago. I would give it a little bit more time, but I would also really think about what they did. And then what product did they use? I know you're a Black woman, so you want to make sure they're not just using like a soft hyaluronic acid filler. It's not going to show up in our faces as women of color with fat in our face. Like we need something thick, like Radius, to make the difference. Okay. How long for balloon face to go from smile lines and under eyes? I don't know what that means. I don't know the balloon face to go from smile lines If you feel like your under eyes or your smile lines look sunken, you meaning, then I don't know. Tell me that. Best filler if you want a facelift in the future to avoid complications doing surgery, maybe hyaluronic acid, but ask a surgeon. Is Ravenance better than Juvederm? Thank you so much. Depends on what area of the face you're treating. They're both hyaluronic acids that are kind of soft. Yeah. They're both like kind of soft. Depends on where you're treating. They're kind of similar. I think you'll be okay with them. Lips, yeah, I think it's fine. Balloon and puffy from fillers. Do you feel like you got balloon face or puffy after fillers? If it's like you just did it 2-3 weeks ago, give it some time to settle. If it's like, oh, you've had this a long time, it could just not look right and get it dissolved. But this is me saying it. I'm going kind of fast. I need to just hear more, guys. Like, you see, I'm gonna be yapping. Like, I just need to hear more about your specific story. So when I'm reading these questions, I'm trying to give you like a quick answer, but realistically in my mind, I've got like 20 questions that I have to ask you to follow up to really know. And I got to see your face. I got like so many questions because I need to know the whole story before I can give you the full thing. Does soft filler migrate? Again, if you're not messing with it, you should be fine. Like, but I got to hear a story. What is a filler? I will say I don't use a ton of regular Juvederm. Like, I don't use a ton of the old school fillers that were only out when I first started because the technology has improved so much. I feel like now it integrates better. They don't get so puffy and hydrated, you know. They don't leave rocks in the skin. Like, there were some products back in the day, man, that's all we had was like a few things, and it wasn't that great. I mean, we did the best we could, but I was like, you know, it wasn't that great. I wish you were in Tampa. I like to go to Florida. I take my kids on cruises there. What fillers do I use? I use a lot of Radius calcium-based filler to mimic bone. I use Juvederm Voluma. I use Restylane Lift, Restylane Contour. Those are the main ones that I will grab every day, but I also will use Define, Kiss, Bellatero. I use a lot of it. Like, it just depends on the person and the part of the face. And like, in one person, I'm likely using different products depending on where we're treating and what's going on. So come to London, please. I have gang of patients from London that I see routinely. I think you were saying some products and I was like, we don't have that here. Can you do Ryo Repill under your eyes? Yes, I love it. My eyes, I love my whole everything. My husband loves it, and he's a dude that says he never sees any change, and he always asks for it. Okay, I just want to make sure I'm trying to scroll and see if there's other ones that I missed. I'm just trying to go back. Balloon face, I still don't know what that was. Sunken under eye solution, we talked about that. We talked about heavy lower face. Again, located in Los Angeles and Las Vegas. Okay. I think I hit them all. I don't like to miss questions. If I missed your question, please, you can send me a message or text the number. Like, my team and I will not miss those, and we'll get back to you. My favorite filler, playing favorites. Okay, I love Radius. I love it. It is remember, the one that mimics bone. It's thick. I like it for cheeks, jawlines, chin. I see a lot of people of color in my office. I see a lot of everybody, so don't get me wrong. I see everyone. But like, people that have more fullness in their face, and so I need something a little thicker. In previous clinics I've worked at, you know, I only would see white women that were ages 50 to 70. And so they didn't have as much fat in their face. Radius would be a little bit too angular. However, with Radius, it is very versatile. You can you can dilute it down, call it dilute Radius. You can read great research papers on this internationally, hyper dilute Radius. It has collagen stimulating properties. So I can thin it out a little bit and use it. I can use it on anybody's face. You just can't put it under the eyes. You can't put it in the lips, but it's great for collagen. I love it. I have it a lot. I had it a lot in my face. I just haven't done it in 3+ years because I'm breastfeeding that baby. So I've been doing the natural filler. But yeah, I don't get paid by any of the companies. So I just tell you what it is. And the products I do use, guys, if I'm telling you something, I'm only going to tell you things that I like truly believe in and can get you dang results in and show you freaking receipts. I'm not going to play around with your face. That's not what I do. Anyway, I should probably go home and feed that baby. What are my thoughts on getting injections in your nose to slim the nose and nostrils? Yeah, you can do that. It's not going to be a nose job, but it can like minimize the flaring. You can do AOL. You're asking me things that we don't have in the US FDA approved, so I don't know all of these. You can make filler down the bridge to create like a little bit of a highlight. If your nose is really, really wide and full, I probably wouldn't do filler. I would just look at getting a surgical consult. Okay, my husband is on this live, you guys. Kenny Brown, DDS, he logged on to tell me to come feed this baby. Thank you, husband. Aerolase for hair removal. Yes, it does. Does it work on fine hair without? Fine hair is a little bit harder for it to pick up. It works on dark hair, not blonde, not silver, even red. Fine hairs are just harder for it to pick. Coarse hairs it can pick up easier, but it can do the fine hair. I'm gonna go home, guys, because my husband is calling me to go home. Okay, if you have questions, please reach out to us. You can set up a consult. We can talk one-on-one. Nobody here got on today. Somebody was trying to, and I think I was yapping too much, and she was like, girl, bye. But we can always talk on here. If you want, we can talk one-on-one here. We can talk on our virtual consults. We can talk in person. I appreciate you. God bless you guys. Good night. I'll also post these on my other channels because some people just like to rewatch them. Okay, I'll talk to you soon. Have a good one. Bye.